So from that kind of broader holistic overview, genetics are not causing disease per se. They will likely correlate, we'll likely see certain patterns appear at the DNA level, at the biochemical level, as we encounter different traumas, different stresses, different environments that elicit those responses. So rather than trying to look for genetic codings or patterns and using that to explain why you may manifest a particular disorder or disease, it helps to see what stresses might have triggered that, what's going on in your life and your environment, both our biochemical environment and social environment, that's leading to that particular genetic expression being brought forward. And if we're looking to heal, the solution lies in understanding that broader context, seeing what stresses we've encountered, how we've reacted to those stresses, and if we want to recover our health, we need to either clear away or relieve ourselves of those stresses, so not be putting those overwhelming pressures on ourselves, or to build more resources or more effective and efficient ways at handling those stresses so that we're not reacting in a way that's creating an apparent pathology or dysfunction. So either we reduce or resolve the stresses or we access better, more effective ways to handle those stresses in our life. And that's how we're likely to bring about what we would call healing or recovery from a disease or disorder. So just pointing to a correlation between genetics and a disorder or disease is not really empowering people to heal. It's not telling the whole story of what created a particular pattern, of why some way of adapting or responding that your ancestors may have developed or accessed is also activated now in your life. We want to really look at the whole picture, at a systemic understanding of what's happening if we wish to foster and facilitate healing. We may need to change our environment or our lifestyle. We may need to shift our diet, the things that we're consuming and exposing ourselves to. And we may also need to shift our mental processes, how we've interpreted different experiences or events in our life, so that we can process those in a way that's more empowering, more self-affirming, that allows us to hold on to our own sense of self, our self-worth, our self-love, our self-compassion. If we're feeling anger, shame, guilt, fear, all of those types of emotions can constrict our body in some way. They can alter how energy is flowing through our body and supporting physiological processes. So working on all these different levels brings the potential to have more success, in a sense, with facilitating healing. I hope that this broader explanation of the role of genes or genetics in our health and how it relates to any perceived disorder or disease gives you some insight or ideas about how to approach healing how to look beyond just a label or just a correlation to see the deeper processes that are unfolding, so you can find ways of intervening that will support your healing or your recovery. For those who are interested in exploring more about holistic health, I invite you to visit my website, phinsights.com. That's spelled PHINSIGHTS.com. And for now, I wish everyone a pleasant day. Namaste.